There are many different birth control options out there, but how do you know which one is right for you? I'll be introducing you to the methods of birth control available at myHealth. Then your care provider can answer any further questions you may have when you meet for your appointment. As young people, it's important for us to take care of our bodies. The choices we make now can have major lasting consequences later. Having sex is a big deal. And if you plan to have sex, are you protecting yourself from sexually transmitted diseases and pregnancy? I know you've heard this before, but the only 100% effective way to prevent pregnancy is abstinence. And the only 100% effective way to prevent sexually transmitted infection, or STIs, is abstinence. It may seem like everyone else is doing it, but that's just not true. It is okay to say no to sex until you're ready, and it's also okay to decide not to continue having sex. However, if you're planning to have sex, we want to make sure you understand your preventative options. There are two basic concepts to understanding how birth control works. The first is menstruation, which is when the uterine lining sheds
and a person bleeds monthly
or regularly. The second is ovulation, which is when an ovary releases an egg. Each form of birth control works differently to prevent pregnancy, but I'll get into more of that later. MIRENA IUD is a long-term birth control method that lasts up to 5 years. It is a small T-shaped device that is placed inside the uterus and slowly releases small amounts of a progestin hormone. This is an estrogen-free method and is one of the most effective forms of birth control, with over a 99% success rate. MIRENA works in 3 ways. It thickens cervical mucus to prevent sperm from entering the uterus, stops sperm from reaching an egg, and thins the uterine lining. The device is inserted by a provider, and there tends to be some discomfort involved. You can expect to have period-like cramps for a few days following your appointment, as well as irregular bleeding or spotting for up to 6 months. On the bright side, most people have no period at all by the end of the first year. MIRENA needs to be removed at the end of the 5 years by a provider, but it can be removed sooner if needed. Fertility returns immediately after the removal of the device. MIRENA does not protect from sexually transmitted infections like most other birth control methods, so we still recommend the use of condoms. NEXPLANON releases a steady low dose of a progestin hormone into your bloodstream and does not contain any estrogen. It prevents pregnancy by stopping the release of an egg from your ovary, thickening the mucus in your cervix to prevent a sperm from reaching an egg, and changing the lining of your uterus. The average time to actually insert a NEXPLANON is under a minute, and you only need to keep a dressing on your arm for 24 hours. Your provider will make sure that you feel the device under your arm, but others will not notice that you have NEXPLANON unless you tell them. NEXPLANON can easily be removed by a provider after 3 years or at any time you decide to remove it. The average removal procedure takes less than 4 minutes. A small incision is made on your arm to remove the device. Once removed, you may become pregnant as early as the first week after removal. The most common side effect is unpredictable bleeding patterns for the first 3 to 6 months. NEXPLANON does not protect against HIV infections and STIs, so we still recommend using a condom to prevent these infections. DEPO-PROVERA is an injection you receive at the clinic in your arm or butt muscle every 3 months or 13 weeks, and it contains the hormone progesterone. This method also does not contain estrogen. When taken on time, it is more than 99% effective, making it one of the most reliable birth control methods available. DEPO is a great option for those who don't want to think about birth control every day or have trouble remembering to take their pill on time. You only have to stop into myHealth for the shot 4 times a year. The most common side effects are short-term irregular menstrual bleeding or spotting, no period at all, weight gain, increased appetite, depression, and headaches. We recommend taking a daily calcium vitamin with DEPO since there's a risk of bone density loss over a long period of time. DEPO is a reliable form of birth control, but does not protect you from sexually transmitted infections, so you should always use condoms for STI protection. The ring is a thin, flexible plastic ring worn inside the vagina to prevent pregnancy. It is also known as the brand name NUVA ring. It comes in one size that works for most people and is more than 99% effective if used correctly. The ring contains 2 hormones, estrogen and progestin, that slowly go into the body through the skin in the vagina. These hormones tell the body not to ovulate or release an egg. The ring works on a 4-week cycle, so a new ring is inserted once a month. It is kept in place for 3 weeks and then removed for 1 week, which is typically when you would get your period. A person using the NUVA ring will need to be comfortable inserting and removing the ring themselves. This may seem a little awkward at first, but becomes easier with practice. Your doctor or trained provider will walk you through the process of insertion. If you are a heavy smoker, have certain kinds of migraines, headaches, or high blood pressure, the NUVA ring may not be the best choice for you. You can talk with your provider to find out if the NUVA ring is right for you. Benefits of the NUVA ring include regular periods, shorter and lighter periods, less cramping, and only having to think about birth control once a month. Most people do not experience many side effects of the ring, but some users may experience vaginal irritation, increased discharge, mild nausea, and breast tenderness. Most partners do not feel the ring during intercourse. In fact, studies have found that 97% of both men and women could not feel the ring during sex. The NUVA ring does not protect you from sexually transmitted infections, so you should still use condoms. The birth control pill, commonly known as the pill, is easy to take and is highly effective if taken every day. For most types of birth control pills, you swallow one pill each day around the same time for a month-long cycle. The final week's pill has no hormones. It is a reminder pill to keep you in the habit of taking a pill each day. This is when you will get your period. There are also certain birth control pills you can take to not get your period at all. There are many kinds of birth control pills, all varying combinations of two female hormones, estrogen and progesterone. These hormones stop your brain from signaling the release of an egg every month, so you don't ovulate. If you are a heavy smoker, have certain kinds of migraine headaches, or high blood pressure, the pill may not be the best choice. You can talk with your provider about which type of birth control pill is right for you. The pill is 92 to 99% effective if correctly used, and it can make periods more regular, cramps less painful, improve acne and PMS, and help protect against uterine and ovarian cancer. However, it can also cause irregular bleeding, breast tenderness, headaches, nausea, or moodiness. Serious side effects are rare, but it's still important to talk to your provider about your medical history. The pill does not protect you from STIs or HIV, so it's recommended to use condoms with this method of birth control. Emergency contraception, or the morning after pill, is an over-the-counter medication that is taken after sex to prevent an unplanned pregnancy. People use emergency contraception following unprotected sex or birth control failure, such as forgetting to take birth control pill or improper condom usage. Emergency contraception can be taken up to 5 days after unprotected sex, but the sooner it's taken, the more effective it is. Emergency contraception is safe to use and may prevent an egg from being released or prevent the sperm and egg from meeting by thickening the mucus around a woman's cervix. It may also work to thin the lining of a uterus so that an egg can't implant. Contrary to popular belief, emergency contraception is not the abortion pill. If a female takes it within 5 days after unprotected sex and is already pregnant, it will not work. There are two different types of the morning after pill, and the type a person should take depends on their body mass index and how long they waited to come in for it. A nurse at myHealth will help you decide which one is right for you. Second to abstinence, condoms are the most effective non-prescription method of preventing pregnancy and sexually transmitted infections during vaginal, anal, or oral sex. If used correctly, condoms are 95% effective, and they're the only form of non-abstaining birth control that can protect you from STIs. Condoms can be made out of all different materials like latex or polyurethane, and they come in all sorts of different textures, colors, and sizes. It's really important to make sure a condom is the proper size before using it to avoid breakage or slippage. Some condoms are lubricated, making the condom more slick and comfortable to use during sex. You can find them at most convenience, grocery, and drugstores, or anywhere you could find toiletry and self-care products. The best part? Condoms are easy to access, and they're affordable. Here at myHealth, you can get them anytime for free. If you have any questions about birth control, your care provider will be happy to assist you. And more information about condoms or any of the birth control methods offered here can be found by visiting our website at myhealthmn.org.